Yeah, thank you for having me. My name is Ashvin Asava. I'm the Chief Revenue Officer at SpinSci. I've been here for about 8.5 years, and I got to see SpinSci grow from 3 health systems to 169 health systems. Um, Part of that was how do we kind of scale with our partnerships, and partnerships is something that matters a lot for me. Um, Also, a little bit about myself. I'm an avid golfer, and I like to get out on the golf course at sometimes. Yeah, absolutely. I think, there are 3 metrics that we're constantly looking at. Number one is call handle time, right? We are constantly obsessed with the call handle time that it takes for a patient to fulfill that transaction, whether they're a reg patient or a non-reg patient that's there. Um, and so we think that with our AI coworkers, we can bring down that call handle time drastically for health systems and patients to execute those specific transactions. The second metric that we're looking at is abandonment rate. How many folks are abandoning out of the IVR experience because they're in the constant endless loop that might be there. And so we think we can provide a frictionless experience with these coworkers to where you can take the queue time, which might be, 10 minutes, 15 minutes, and create a zero depth queue because you're always going to have an FTE or a coworker or an AI coworker that's available and able to take that specific transaction that's there. And so we want to see that abandonment rate go down. And then the last one is first caller resolution, right? And these are 3 high level metrics that our team looks at when they're approaching the health system. But the first caller resolution is important because you as a health system has many resources. You have a scheduling team, you have a billing team, you have a new appointment team, you have an existing appointment team, you have an information services team. And so we want to make sure that that call gets routed to the right place the first time, right? And that's where we've created this patient steering switchboard AI coworker that really disambiguates what the patient is saying. Is it a critical medical question or a medical question? And it gets you routed to the right resource at the right time. So we've been focusing at a high level and at a macro level on those 3 metrics, and it's been helping health systems transform their contact center into a patient access center. Yeah, the future call center is going to be uh, number one focused on how we can improve access for all the different patients across different demographics that are there. And that's going to be really the future is how do we, really normalize this experience to where patients can have access to their medical records. They can make changes at their specific time and at their specific preference, and also at their specific medium as well. And so that's where a lot of these AI coworkers are going to be helping not only the FTE throughput for a lot of these different health systems on answering the need for these different patients, but it will also help scale a lot of the different operations internally. And there's going to have resources at their fingertips that they can deploy for a lot of these different challenges that are out there in healthcare. Well, I think the number one thing to look for is a tried and true partner that's not just focused on the AI coworker side of the house, but also the workflow side, right? We know that a lot of these different patient access workflows, such as scheduling, billing, pharmacy, it requires a certain amount of compliance, both PHI, PCI, PII certified. It also requires a certain amount of expertise around knowing the workflow around that specific EHR that's there. And then, of course, you want the number one AI platform that's out there, and that's where SpinSci has a edge in all 3. We're the number one healthcare AI platform that's out there. I think SpinSci has really built out four key pillars in the industry. Obviously, we started in the patient access side, 9.5 years ago in healthcare, where we were tackling workflows such as scheduling, billing, referrals, orders, triage, and any patient that was trying to access their clinical needs or healthcare needs, we were creating a frictionless experience. We've then scaled into the inpatient world where we've built out an operator console, and that operator console allows inpatients to be, and loved ones to be routed to their inpatients. It allows you to dispatch code calls and emergent calls that are there. It allows you to do, full directory lookups and full inpatient lookups that are there. And you can also traverse your clinical comms and paging from this inpatient operator console. We've then scaled, obviously, to the agentic voice side of the house, but we're not just an agentic voice player from an AI coworker standpoint. We've also built these co-pilots that allow you to enable almost a one-click scheduling experience. What we've been seeing in the industry is about 6.5 minute call handle times for a reg patient and a 12-minute handle time for a non-reg patient. And we believe we can cut that down into a minute to 2 minutes, which is drastic savings for these patients and agents that are there. And then the last piece that we're triple focused on is our patient financial services arm, where we are now a payment processor. Before, we used to build a lot of the billing self-service tech, a lot of the billing reminder tech that's out there, but we're now a payment processor that's out there that's a tier one payment processor. So we could do fraud detection, we could do price transparency, we have the ability of setting up an FLP from that standpoint. So when you look at where we see the future, we think that it is a one-stop shop where we can help orchestrate a lot of these different workflows with AI and make sure that you have the FTE productivity and throughput for your organization.